Hi guys, hope you all are having a good time and hope you all are prepared enough and in a good mental state for going for your 12th of December Fmge exam. This is the last piece I want you to remember, and remember it very properly because there are high chances one question out of it would come. This one page can solve one or two questions, so please do not miss this one. Alright, so let's go on with it. This is one of the most high yield table you need to remember for your exam Fmge. First point would be the unit. The unit used in both of these, case control and cohort, will be individual, so nothing much to remember. Other name what is usually asked is retrospective and prospective. See, in case control we are going from effect to the cause, so it is retrospective. We are going back, the effect is already there, then we are going to what caused it, so it is retrospective. In prospective we are obviously going from the cause to effect. Listen to it one or two times and you'll remember. Now the correlation between the variables which is most commonly asked is the OR, your odds ratio, in the first one, which is case control, and in the cohort there would be incidence, relative risk, attributable risk, PAR, all these things. So I think cohort you will remember that it's incidence. For case control and case cross selection we often confuse. So what I want you to remember in case control is the case control looks like CC. So if you turn this C other way around, so it becomes like a O. So that's how you remember that in case control you will have OR, which is cross product. Alright, let's go to the other form of question that they can ask you. They might ask you that case control is a study of choice for. So it would be for rare diseases, and same way in the cohort it's not rare diseases but is the disease with a rare risk factor. Okay, these are the keywords you need to remember because they will try to confuse you among it, and the option case control and cohort both will be there, so it's easy to get confused among these two options. Now last but not the least, the time taken. They often tend to make a question, or they will give a hint or clue in the question, they will be explaining it. So in case control the time taken will be less because effect is already there and we are just going and looking back what caused it, so there won't be like a lot of time taking into it. We'll be looking at them in a shorter time period. On the other side, if we are going for a cohort study, we are starting with the cause, okay, and then we are following up the people for a long time and seeing what effects are there or not. So it takes a lot of time, so it's more time consuming. There are a few more points that I would want you to remember for cross-sectional and ecological studies where the question come from. So the cross-sectional studies also the unit will be individual. Only the unit is not individual, that is in ecological studies where the unit is population. I'm sure you must be already knowing that. It is a very common repeated question. And the cross-sectional is also a snapshot of the population. This thing you have to remember. And what correlation between variables we see here is of prevalence. See, we already read the incidence, so prevalence should also be somewhere, and we know the prevalence is not in case control, so where it's going to be in cross section. Just correlate it and remember it. That way you'll remember it forever.